Good morning, now time for your weekly Kasuth Regional Health Center talk. I'm Mike Vandy, joined this time around with Dr. Hjelle. Dr. Hjelle, we've had you on the program before, but for those that may not know, we've talked about your role, but we haven't talked about your role with Ageless Solutions. What is your role with Ageless Solutions here at the KRHC?
Ageless Solutions, down in the basement part of the clinic. We have our own separate little entrance, but my role here is medical director and also providing some aesthetic services that are not surgical down here, such as Botox injections, fillers for wrinkles. We do a microneedling thing that we've talked about last year, and various light therapy for hair reduction, and sclerotherapy, which I find really fun to do.
Now let's talk about those services you just mentioned as well. How long have you been offering those services?
We've been doing these about 11 or 12 years, so we've had this area about that amount of time. When we added onto the clinic, we added this area downstairs. So I think for a couple years I was kind of doing it out of one room up in my office, but now we've kind of focused the day where we try to do it down here. We have Chloe Gielen down here for doing extra procedures such as facials and other skincare type things that complement the other things we do, such as the injections and other stuff. So I'm down here on Tuesdays all day to do injections and other things that I do. But Chloe is also available here on Wednesdays and Fridays in addition to the Tuesdays.
Now you mentioned something just a little bit ago, sclerotherapy. Tell us exactly what that is and what this service does.
Sclerotherapy is treatment of spider veins, which tend to be unsightly and bother a lot of people. They tend to be more in women because there's a theory that they're related to be hormonal, such as estrogen or carrying children or things like that. And spider veins are those very dark purple or maroon colored veins that look like a road map. If you look at a road map, it looks a lot of little communications and road maps. Some people just have the spider veins. They're just these tiny little things that are very visible. They don't want them seen, but otherwise it doesn't give them any trouble. They don't have like painful legs or things like that. Others have those in addition to bigger varicose veins, and those are more ropey and can cause some achiness, and they're often associated with people that are on their feet a lot, such as nurses or people that do hair or dental hygienists that are on their feet a lot. And when we do a consult to look at someone's veins, we always evaluate if they have those bigger veins. If they have those bigger veins, we probably have to send them to a place to take care of the bigger veins. But as far as the spider veins, first of all, I find it a lot of fun to do them because you can it literally looks like magic. We use a solution of very concentrated saline. It's called hypertonic saline mixed with a little lidocaine. And we clean off the skin with some green rubbing alcohol, because the green rubbing alcohol both disinfects and it kind of helps you see the vein a little bit better. We use a very tiny needle, and I use these magnifying glasses so I can see things better, and just inject into the beginnings of these veins, and literally as you inject, the vein will poof and kind of disappear. And what that does is that chemical, that hypertonic saline, when I get it inside the vein, it causes some damage to the inside of the vein, and then it will scar in. And when it scars in, blood flow doesn't go into it, so then they fade away. It sometimes takes more than one treatment to do that, but usually there's a significant reduction in these smaller spider veins with doing these injections. It's, like I said, it's relatively painless. We haven't had anybody scream and holler down here yet. It's just then we provide a little bit of compression after the procedure, where we use an ACE wrap to wrap around and provide some pressure issues in the lower legs. That's mostly where these are. Legs and ankles and feet are a common spot also. Like right after the procedure, we don't recommend being in a hot tub or taking long baths for a few days, because that makes veins dilate. We want those things to constrict down and go away. And sort of the reason we're bringing it up at this time of year, it's a good time of year if you're thinking about the short season, which seems a really long way away right now, doesn't it? I don't think we're going to have any melting anytime soon the way things look. But it gives us a chance to significantly reduce those leg veins before summertime.
Now, you've mentioned what patients can kind of expect with this service here. How long do the effects of this procedure last?
The procedure, if we're able to get into these veins and cause them to collapse, is basically what we're doing. Those should permanently go away. You can always form more ones later. When I mentioned the varicose veins, or those bigger veins earlier, if you tend to have those, we have to look further, because if you have a varicose vein, it can be like feed those smaller veins and keep them open. So we just do a real good scouting report when someone comes in for a consultation. We examine the legs and look really close, take a little bit of a history to see if they have any varicose veins or soreness in the legs or things like that. And if not, we usually can proceed to do the injectable therapy.
Now, as far as timing, maybe people are wondering, when's the best time to do this kind of procedure? Is there any advice about that?
Well, yes, because it is doing procedures on legs, and I talked about we have to wrap them up and provide a little pressure. It's best when it's not going to be short season. The short season, not too many people want to have their legs wrapped up in ace wraps in the summertime or even the late spring when it's warmer. So this is a good time of year to help reduce those before short and swimsuit season comes.
Now, if people are looking to learn more about maybe sclerotherapy or any of the services here at Ageless Solutions, how can people find out more information?
To call our clinic, you can call 295-4564. Okay, you can find us under Facebook under Ageless Solutions. We do some posts there periodically. Everything's private, so we don't ask that nobody ask any real medically related questions, but sometimes you can private message Chloe through there to make appointments, especially be on our cancellation list if something like that happens. Also on the KRHC general website, there's a link. You can look at some of the stuff we do.
Dr. Hjelle, thank you so much for your time. We'll speak to you here down the road.
Okay, thank you.
This has been your weekly Kasuth Regional Health Center report. You can hear a new report every Thursday in the 9 o'clock hour, about a 9:05 start time. And then you hear the repeat of that show every Tuesday, same time, about 9:05, heard right here on Hometown Radio, KLGA.